Los Angeles is home to millions of people looking for a healthier lifestyle. Well, look no more. Your World Today is here and is a show offering you a wide array of topics to improve your quality of life. From a healthier living to making smarter decisions. Welcome to Your World Today.
Hi, and welcome to Your World Today. I'm Kerrigan Von Poli.
And my name is Ofelia de la Torre, and we found another doctor.
We found another doctor to talk to. And we're here at White Memorial Medical Center talking to Dr. Ahmed Macky.
Thank you.
Dr. Macky, thank you so much for joining us.
Thank you very much.
And today, we're talking about something that's really important to me, men's issues.
Absolutely. We've been talking to some doctors about men's health, and so we want to cover the area of skin cancer, doctor, since you're a plastic surgeon, cosmetic surgeon, and otolaryngologist.
That's good.
That was
Oh
good.
my
You did
God.
well.
That was very good.
So let's concentrate on skin cancer.
Sure.
And I know guys don't put enough sunscreen and don't wear hats, and a lot of my guys don't, and this is an issue. So I'm wondering, what are the stats on that, doctor?
Yeah, so men are notorious for just not being, evaluated by physicians on a regular basis, and with golf and different activities that a lot of men do.
Soccer, hello.
Soccer, yeah,
Surfing,
absolutely.
I'm into that
Surfing,
one.
Yeah. They're exposed to the sun quite often. 1 in 5 Americans will have a skin cancer bout at some point in their lifetime. Another kind of interesting stat is over the last 3 decades, skin cancer alone has exceeded every other cancer in terms of population density. So it's definitely something that's important to me, and in terms of evaluation and trying to get people involved in the process early.
So what are some of the signs somebody should look for when they think maybe I have a lesion, or they're not really sure?
For those individuals that are light skin, light eyes, you're kind of that guy.
I fit the bill. I know.
You obviously need to be more prudent, I guess, about evaluating yourself on a regular basis. Things you want to look for, we call it is the ABCs. So A would be asymmetry. When you're evaluating a mole or what's called a nevus, if you're able to put a mirror image on it, cut it in half, it should be symmetric. If it does appear to be somewhat asymmetric, that tends to be a sign. We also look for B, which is the borders. The borders need to be irregular borders versus kind of erratic. Also the third one would be color. One thing that's notorious for malignant changes is color changes, and also just an awkward appearing color, which is like a brown or a blackish appearance oftentimes.
Doctor, how dangerous is skin cancer? Is it mortal?
It depends on the type. So your 3 main skin cancers are melanoma, squamous cell carcinoma, and basal cell carcinoma. Melanoma is sort of the one that you do not want, and the one that really needs to be caught early. And that's the one that's notorious for metastasizing. And
then you mentioned blonde hair, blue eyes, light skin, that I'm at greater risk.
Mm-hmm.
Are there certain ethnic groups specifically that are at greater risk, or does it just really have to do with pigment? And
It's pretty much just mainly has to do with pigment. Europeans, Anglo-Saxons are more prone to it. Hispanics, Arabic, Mediterranean are less prone. And obviously African Americans as well are probably the least prone in terms of skin cancers. Although it can happen depending on sun exposure, especially for like Mediterraneans, Hispanics, which were exposed to the sun often, whether it be sports or work conditions or whatnot,
Right.
They need to be really prudent about evaluating themselves.
So what are some of the precautions we need to take into consideration when we are out? And by this, if we do it, our kids see us do it, so we need to instill in them this practice.
Yeah, absolutely. Like I said, for someone who's lighter skinned, they need to be wearing protective clothing. Oftentimes people think that they can just wear sunscreen and go out and sunbathe all day, and that's going to be the end-all, be-all of preventing skin cancer. Most sunscreen has a time limit regardless of whether you're in
Right.
the water or not, and more often than not, people are forgetting to reapply. So reapplications of sunscreen, wearing sunscreen in general. One thing that's often missed is most people wear sunscreen when they go to the beach, but most people don't wear sunscreen when they're driving in their car or
Right,
just out
right.
on on a daily basis working. So it's important to have a good sunscreen that you're wearing every day to work, even if you're not in a sun-exposed work environment.
And I've always seen, you see those sunscreens that are like 90 SPF.
Mm-hmm.
Is that a real thing? I mean, are those more effective than a 30
Is it
SPF?
true?
Yeah, there's different trains of thought on that. The general consensus is that anything over 30 to 50 is somewhat of a waste.
Doctor, why is it that when you go to the beach and you put on the sunscreen and it gets in your eye or you perspire or you get in the water, it stings? Is that a bad sign not to buy that sunscreen?
Not necessarily. It's just the components or the ingredients that are in the particular bottle. It's just, especially with the eyes, the mucosa of the eyes is very sensitive to anything. Even normal saline can cause some stinging. So it doesn't necessarily
So it is
mean-
normal
Yeah.
for your eyes to sting?
Absolutely.
Okay, all right.
And then suppose we've come to the doctor, we have an area that we're concerned about. Maybe it's skin cancer. What are some of the treatments or what are some of the therapies that you use with patients?
So there's different treatment options. There are non-surgical and, of course, the surgical options. One of the things that should be mentioned is Retin-A is a really good product for prevention of skincare and also really limits wrinkles formations. Any patient that I operate on in terms of a facelift or cosmetic surgery, I always have on Retin-A afterwards because it it treats precancerous lesions.
Really? Okay.
And it can kind of get ahead of the curve. But when you do see me in that office for a particular skin cancer, there's topical treatments like one, for example, is called 5-fluorouracil, a big name, but essentially it just helps change those cells that have gone malignant into more benign ones.
So there's no real surgery, it's more topical products?
For cancerous, for malignant changes, there's absolutely surgery. Basal cell carcinoma and squamous cell tend to respond or the best, I should say, to surgical treatment because you can get around the border and completely eliminate it. Some things like melanoma tend to invade deeply and need to be sort of chased a little bit more.
So I'm going to go off a little bit of the topic, but not really. I'll go back to it. So for women, it's so important to not age. And I know that the sun, I've been told, is the biggest enemy for
Yes.
women. And then, of course, if you're sunbathing, well, cancer is like a obvious thing that happens if you don't take care. When shall we start as women, for the aging process? When do we start taking care? How? And what are the best products to wear?
Yeah, believe it or not, you should start at the age of like 20
wow.
to get ahead of the curve, to prevent wrinkles. The best product is some tretinoin or Retin-A. It's basically a vitamin A derivative that helps not only treat precancerous lesions, but also it just rejuvenates and recycles all the skin cells.
So you're going to save me and save us hundreds or thousands of dollars by
Down
just
the
saying, just use Retin-A.
Absolutely.
Okay,
yeah,
because
yeah.
that's expensive. Cosmetics, whew,
Yeah.
it's a whole different industry, a whole different topic. Doctor, we'll be right back. We have to go take a break.
Quick break.
But we'll be right back and we'll continue this very, very interesting conversation.
Welcome back. This is Your World Today. We're continuing our conversation with Dr. Mackey, and we're talking about skincare and sun exposure and how to stay healthy. So,
Well, it's women's worst enemy, and I try every time I go out to the beach and to the mountains and on trips. But we're learning with you, doctor, that we should do it every day to go to work.
Absolutely.
Also.
Absolutely. Like I said, one of the things that people forget in the morning is to wear a SPF moisturizer. So most moisturizers do have a little bit of SPF in it. It could be 10 to 15. But for someone who has lighter skin, they really should be applying a SPF 30. You can apply I tend to say most moisturizers that you can buy in the supermarket are sort of like splashing water on your face if you're not careful about what components are in it. And you really want to verify that they have a good SPF component in it. It should be worn every day.
So how do we take care from aging so much with the sun?
Retin-A is like gold, really.
Okay.
Retin-A or tretinoin, really the only precaution is pregnant women should not be using it. but otherwise it helps renew epidermal cells and skin cells.
And you should use it forever?
Yeah, believe it or not.
Okay.
I've seen 70-year-old women in my office who I have actually asked, how do you look so good? And they've told me I've been using Retin-A for 30 years.
Wow.
So, doctor, you mentioned that pregnant women should not use Retin-A, and why is that?
It's considered a Category C drug, which basically means that it has not been tested in pregnant or lactating women.
Okay.
So I insist, doctor, going back to not aging with the sun and with time. So preventive measures, Retin-A, sunscreen, and at the same time we're protecting ourselves from cancer and moles that might change with the sun as well?
Just being very sensitive in terms of examining yourself and being aware of the moles that you do have. One of the things we really look for is evolution or evolving moles. If you've had a mole since you're 18 and you come into my office and you're 30 now and it looks similar to how it was, it's probably not likely to be cancerous. Very low. I have a very low threshold for testing, biopsying something like that. But for someone that comes in that's had an enlarging lesion, that's more concerning.
And I bet some of our ladies out there are thinking, well, I took a lot of sun without, I remember the days when people used to use baby oil and go out and sunbathe.
Basically baste themselves in the sun, yeah.
Basting, and they already did that. How, can they do something? Is there repairing
Yeah,
therapies?
believe it or not, that tretinoin or that vitamin A derivative I spoke about does treat precancerous lesions. So even if you don't have any cancerous lesions now, it will go ahead and help treat those.
So it'll reverse the lizardy looking effect, huh?
It can, to a certain extent.
Yeah, of course.
So on a personal note, I love to surf. I love spending time in the ocean and in the sun. I need to make sure that I have plenty of sunscreen on. Zinc oxide is something you see a lot of surfers use. Is that effective to block the sun and act as a barrier?
Zinc oxide, believe it or not, is a great product. It just kind of looks funny when you wear
the
it.
paste thing?
That's the
Yeah,
white
it's like the
nose,
white
yeah.
nose that you see
Right.
is
The
so
lifeguard.
iconic. Yeah. Okay, well that's good to know. I'll keep doing that too.
Someone told me, I was in a tropical beach somewhere, and they told me that there's a lot of ear cancers because we don't think of our ears, and it's always exposed, especially in children.
Yeah, absolutely. Ears and nose are
And
pretty much
nose.
the last things that sunscreen are applied to, and even actually toes. So you got to think about the things that people just forget, and ears tends to be one of them. Scalp is another.
Yeah, what if you're bald? I mean,
You have
do
to
we
be
think about that?
Yeah, you have to be very, very prudent about applying lotion. Even if you do have hair and you wear a lot of gel, that kind of thing. Sun has a real easy way of getting through, and scalp, especially melanomas, tend to be some of the worst skin cancers you can have.
So are there kinds of foods that we can eat that are going to help our skin in any way?
So most legumes or just green vegetables in general have a lot of vitamin A derivatives in them that can help reverse cell aging and also cause cell maturation.
Reversing cell aging, is vitamin A?
Pretty much. Vitamin A is a great
Got it.
product. Yeah.
Got it? Okay, doctor. Oh, yes. I love
So
it.
we need to take another quick break, so stay with us. This is Your World Today, but we'll be right back.
This is great information, girls. Welcome back. We're with Dr. Mackey talking about how to prevent skin cancer, men's health, preventing aging for women, and let's talk about teenagers too.
Sure.
Doctor, acne is a huge factor. I know my 13-year-old has a little acne, and she's just really obsessed and mortified. So is retinol good for them as well?
Retinol is a great product for them. Acne tends to be a debilitating condition for teenagers in high school and whatnot, and Retin-A, when used correctly, can really help stimulate new cell growth and eliminate acne.
How do we use it incorrectly? How do we guard
People,
against it?
Americans in general, tend to overuse things. We like big cars and big houses.
We want to have the biggest
Right.
and the largest. Right.
So I tell my patients a tube of Retin-A should last you anywhere between 3 and 6 months.
What?
really a pea-sized amount of Retin-A is all you need to cover your face. I tend to tell my patients to take a pea-sized amount, dab it on your cheeks, forehead, and chin, and just kind of wipe it in from there.
Less is more. Huh?
Is that
Yeah.
morning and evening?
We tend to start out just once a day.
Okay.
I actually start my patients out once every 3 days for
Okay.
2 weeks, and then go to once every other and once every day eventually.
I'm curious to know if are there like lifestyle changes that teenagers can adopt to help with acne rather than just topical treatments. I mean, are there diet things that they can do? Or
There's been some studies that have shown that reduction, especially saturated fats, can show improvement in resolving acne. Again, any vitamin A derivatives or products in foods can also help as well.
so not as much
sugar?
pizza probably
Yeah.
and cheeseburgers.
Yeah,
and
the good
stuff.
things, yeah.
All the
Why
stuff that
isn't
tastes
my
good.
daughter in here now listening to this? So give us a little summary of how to be healthy with our skin to prevent aging and cancer and acne and what else? The red nose
Oh
diving,
yeah,
surfing effect.
yeah, right.
Absolutely. One is just to be aware of your body, to be aware of also your heritage. If you're light skin, light eyes, you need to be more prudent in evaluating yourself.
Keeps looking at me when he
I
says
know,
that.
I know. We're all looking at you in the room.
You're right
Carrie.
there. I mean, just evaluating the moles that you do have and making sure that they're not changing. And if they are, just to be evaluated early by a physician.
Doctor, real quick, is a good nutrition, vegetables and fruits related to better skin, better health, anti-aging, and what products?
So, like I said, legumes and vegetables have been related to just in general reducing all types of cancer in that they have what's called antioxidants in them. And also,
So we're looking for antioxidants.
yeah, antioxidants are great to prevent what's called free radical growth. Free radicals are basically when cells start doing their own thing and don't listen to our body anymore and start reproducing inappropriately.
Before we go, what about the eyes? How do we protect our eyes, doctor?
You want to be very careful about the sunglasses that you purchased. Most sunglasses are able to prevent rays from coming through, meaning that they're polarized. But oftentimes, especially the cheaper sunglasses, tend to be non-polarized. Polarized glasses are the way to go.
Right, and we don't think about our eyes very often when we come out to, to the sun or to the beach, especially with little ones. They should be included, right?
Absolutely, yes.
So when should we see a doctor about skin cancer? At what point should we become concerned or just be cautious? Or
It doesn't hurt in general to get good education and good knowledge. That's part of the segment is for that. But if you do have any concerns, to be evaluated early, I would say. Even if you aren't sure about a particular lesion, you haven't really been looking at it for a long period of time, but it just kind of popped up. Getting evaluated by an ear, nose, throat doctor, a dermatologist, a plastic surgeon can be life-changing and life-saving.
so for light eyes, light skin, I should probably be going to see a dermatologist on a regular basis.
Like
just to
every
keep
day.
track. Yeah.
Yeah. No.
I'm going to live next door to the dermatologist.
Oh boy, oh boy. Well, doctor, thank you so much. I
Thank you.
think we have a much better idea of what to do and what not to do.
Very informative, and
Yes.
I need to work a lot harder to take care of my skin, it sounds like.
Yeah, and we all know how to prevent aging and cancer, hopefully. So that's what it's all about. Thank you for being with us.
Thank you.